In this particular position, we have the upper lobe anterior, all right, as its position. Next thing to remember when you do percussion vibration, we do not do it on bare skin. It's like the opposite. When you listen, you got to be on skin. When you do percussion vibration, you don't do it on skin. You always want to have at least a shirt or a layer or a towel. So in this position, obviously, then we have skin here. You have a jacket or t-shirt or something? This one?
Yes.
Okay. So just for the demonstration purpose, and the thickness of it, unless it's really super thick, obviously we're not going to do it over a big ski jacket. Okay. But in this case, just a thin layer. So the position is right here. Yes? All right, so your hand position, no, we got the, we're going to turn it the other way around.
Yeah.
So this way. All right, so we don't have to worry about the good. Two spot, basically right here. Your hand depends on your size of your hand, on how big that person is. If you have a little child, obviously one hand probably will cover the whole area. In fact, they make those little rubber cups to work in a pediatric setting. That they have a small little rubber cup that you can use because the baby has such a little chest. You put your whole hand on it, you know, you're going to basically bang up the entire lung area. So you have it right here. So you're positioning. You find yourself where you need to be in terms of your height, in terms of your reach. Some of the position you can do it this way versus the other way. So you decide where you feel most comfortable, where you have the best reach. Okay, what you don't want to do is, of course, compromise your body mechanic. So in here, if I get a reasonable, comfortable reach, and I don't feel that that I'm stressing over the person's body, I have my hand on this. You can do one side, you can do both sides simultaneously. Okay, if you can reach it, you can certainly just stay on one side and do it like this, and then do it on the other side. Okay. Percussions. What we usually do, just let the person breathe comfortably, just relax, and the rest, it's a wrist motion. Okay, that's the key. You're going to develop, create a little cup. The percussion is the sort of a pocket of air. That's tapping. All right. So same way we're going to be over here. And we're going to start with like so. You ready? Okay. Keep your shoulder relaxed, elbow down. All right, don't tighten up. Don't go, wind up, you're going to get hurt. All right, so you're going to go nice and easy. You know, get real musical, put some music on, follow the rhythm. Okay, is that all right?
Yes.
Okay, and it should not be too stressful, just enough to create enough of a vibration and a shock wave to kind of loosen things up. And remember that ketchup bottle analogy, getting the ketchup out. Okay, so we're getting that bottles out, and after that, we should do this for about a minute or so. You know, it depends on how the person responds. Sometimes just by doing this, it's enough to move things around that they feel like they need to cough. So always remind the person, if you are going to cough, one, of course, make sure the person is turning away from you. You don't want a person, especially nowadays. But now we're going to all be pretty well protected to make sure that we're not sharing anything. Okay, so let's say no cough. Next procedure will be the vibration. And the vibration, the sequence is, you first ask them to take a deep breath, and then you ask them to release the air slowly and making a sound. Okay, so that way you know they are letting the air out until they totally empty. Okay, same way, you want to make sure that the person look away so that they're not breathing directly at you. Okay, So we're going to ask you to take a deep breath and then let it out very slowly and make the sound. There we go. So that's the vibration. You feel the vibration.
Yeah,
There we go. Okay. Let's do one more. Exterior, obviously you're gonna have either they're gonna hop on a pillow or lean over a table. Okay. If it's a sideline, so let's say I'm gonna drop this down. Okay. So if you wanna come all the way down. Okay. So if you're gonna need to lift up, of course the table allows you to do that. So you have the different area, okay? For individual, so let's say you have this section right here, okay? You don't have to do it on the same way. You could do it this way. Obviously, for female, we do not percuss directly on the breast tissues, so you're gonna work below it and around the area. So whether it's lateral or anterior. So clearly, that's something that you're going to pay attention to. You know, and depends on your hand placement. So we're going to have your hand placement right on this area, anteriorly. Okay? So likewise, you certainly don't want to do right on the breast tissue. Also, you want to be mindful to know where the lung fields are. So right here, you're already down to the abdomen. We do not do percussion on the abdomen. Okay? It will not be pleasant. All right? So you also need to pay attention in terms of the positioning. Okay? So same will be true whether it's on a lateral, either side, or when the person is in prone, posteriorly. Okay?
Professor,
Yep.
what's the exact?
This motion. Okay? Like so. Again, you know, you don't feel like you need to do like really super high speed, frantic pace. You know, if this is
Both at the same time.
right. I mean, if you don't have to. Let's say if it's only on this side that you're hearing. It's clear on that side, so obviously I'm just going to stay on one side.